I want you to move from overwhelmed by information to confident in what really matters. I want to help you move from being unsure towards direction and purpose in your healthcare. I want to introduce you to health experts. I want to let you in on tough conversations on women's health. I want to give you a place where you can lean in and learn how to take care of yourself. Let's transform your health. Let's get clear on your goals. This is Women's Health Unplugged. I'm your host, Dr. Jordan Robertson, Naturopathic Doctor. Welcome to another episode of Women's Health Unplugged. I'm excited to have this conversation today. Well, excited and sad, let's put it that way. I'm joined today by two of my friends and colleagues, and we're talking about maternal mental health. Now, the focus of the conversation is going to be about that early postpartum window, but really this conversation is for anyone who is a mother, for anyone who's a parent, really. And so if your kids are grown and moved out, this conversation is still for you, even though we're spending a little bit of the focus talking about that early postpartum window. Because what you're going to learn today is that you probably weren't screened. You probably weren't supported, and that probably set you up for a lifetime of challenges with mental health as a parent or as a mother. And so even though you may be feeling like you're well past those years, this is still a really important conversation for you to listen to. It's also going to help inform you how to support those in your life, whether those are daughters or other people that are going to suffer and struggle through this window of life at another time. And maybe you can be their support person having learned this. So I'm joined today by my friends and colleagues, Dr. Laura Jasmin and Dr. Carly King. Welcome to the show.
Thank you, Jordan. Thanks for having us.
Yeah, so excited to be here.
So the impetus for us doing this kind of three-way conversation is that the two of you have spent the last year getting ready to educate our profession at large around perinatal health and postnatal health. We're actually offering a free training for naturopathic doctors, for midwives, for nurse practitioners, for medical doctors, to be able to learn more about maternal mental health in early January 2023. And so we decided to record this podcast together to get the word out, not just to the public, but also to practitioners who work with people in the perinatal and postpartum window of life. And we'll put the links for how you can sign up for that free training or how you can listen in the show notes. And so if you're a practitioner or someone who works with people in pregnancy and postpartum, we'd encourage you to attend that event. That really, we're offering that event honestly as a charity opportunity for people to connect and learn more, because the three of us feel so passionate about people being better educated about this phase of life for people that we just want you to come, right?
Absolutely.
Right.
We just want you to come. So to get started, I would really love to hear from both of you, basically around how you got to this point of being so passionate about, I'm going to use the words maternal mental health. That's really what the conversation is in the literature, but I think we're talking about a wider group of people who experience mental health challenges after either delivering a baby or having a baby. So we're going to talk about it from all those perspectives. But how did you get connected with this topic in the first place to be this passionate about it?
So I think Laura and I both have some personal stories there. My pregnancy was complicated, to say the least. I was unexpectedly pregnant. I conceived on my copper IUD. And so that was a surprise from the get-go that came with its own risks with potential loss early on. I was very closely followed. And at my very first prenatal visit, my blood work showed that I was in stage 3 kidney failure out of the blue. And so we went from having this idea of having this like nice home water birth with my midwives to all of a sudden being shuttled over to this high risk obstetric care where every appointment was you're going to be at risk, your baby's at risk. And it was stressful. And I ended up having an emergency cesarean delivery. And my son actually suffered from a stroke and two collapsed lungs at birth. We had a long NICU stay after that. And throughout the entire time that I was under the care of both my midwives and my OBs, I was shocked that nobody asked me how my mood was or followed up on that piece at all after all that I had been through. And I was very fortunate. I had a really wonderful support team from my partner and my family and my friends. But it really got me thinking, for those that don't have that, or those that are really struggling and don't have anyone asking them or supporting them in this way, what are we doing with these women? Like, where are we leaving them? And that really sparked my interest and my passion in this topic to really put that information out there and support the people that need it.
Every time I hear you tell that story, Carly, I get like super goosebumps, and I like your resiliency and how proud I am of you of where you are right now. Like every single time you tell that story, I get emotional about it.
Yeah.
Yeah, me too, Carly. Maybe I'll share my story next. I had two very different postpartum experiences. So this differs from Carly's. My first child actually was the first grandchild on both sides. We live close to both our families. So we were really blessed to have this like overwhelming amount of a support for my first. And for my second, I unexpectedly was going to have her, and she was born 2 weeks after our first lockdown during the pandemic. And at that point, I also owned my own business. So I was wrapping up for my maternity leave. I owned a small business. So anyone who else owned a small business at that time knew that it was a really stressful experience. We were all pivoting, which we kind of hate that word now. And my partner was also an essential worker. So he still had to go to work. And when my daughter was born, I was now a mom to two kids under 2 with very little support at that time. And my philosophy was like, you know what, I got this. We'll just keep going. No problem. Keep adding everything on. But I noticed there was this huge gap in postpartum care, how we support parents, and that you can't keep going like that forever. And so from that moment on, I became obsessed with us doing better in this area and raising the standard of care for postpartum patients. And I believe it's really a skill that you have to learn how to take care of yourself while also taking care of little people. And maybe with one little person, I could cope with all of the things that I had to do. And now with 2 little people and my small business and having very little support, I had to relearn how to do that. And so now I'm really passionate about helping other people also learn how to do that piece.
Yeah, thanks for sharing, Laura. I'm going to offer my own story a little bit into this because I'm just like a touch older than both of you. And so I'm coming at it from more of this sort of perimenopause, like what happens after, like the fallout of the untreated postpartum depression piece to me is fascinating. I had a very similar pregnancy experience. So my son, I had lots of miscarriages. My son was my 4th pregnancy in a year, or in 8 months, actually. But my partner and I had just graduated from professional school. We were drowning in debt, and we had no money. And so he had to work a lot. And then I returned to work really early after giving birth. And I did have this like lovely home birth, which everyone was so happy with, and everything was great, except that I had a lot of difficulty breastfeeding. And at that time, and that was like 14 years ago, there really was this emphasis on breast is best. And I felt a lot of like shame and guilt around not being able to breastfeed well. And so I persevered through breastfeeding, like probably way past the point of sanity. I struggled to pump, but then I had to go to work. And like, it was really just this like hellish experience where I didn't have the support. I could get my kid taken care of like for 3.5 hours a week. And that's when I like ran to McMaster so that I could teach, and then would run home, literally pumping and crying while I was driving, trying to like get home because I didn't have enough childcare to actually do what I needed to do. And I honestly believe that that set me up for this. I'm going to use the word wiring because I don't think we quite understand how this works yet, but that postpartum experience for me, I had never in my life had PMS before having a kid. Like never. I didn't even cross my mind that PMS was a thing. I was not a moody person. And after having my son, I really struggled with postpartum mood swings and with PMDD, and eventually ended up taking an antidepressant for my PMDD. But it was that postpartum wiring that we now know happens, that when you struggle with your mental health postpartum, it increases your risk of other mental health diagnoses, including post PMDD, but also depression in perimenopause and menopause, so just being that like slightly ahead of both of you, I'm going to say that I'm coming at this conversation from this is mental health prevention for the lifetime of the woman, not just in that 1 year postpartum. Like that's really setting us up for a lifetime of struggle. So I'm excited for us to talk about this. And hopefully as a listener, again, if you feel like you're well past those years, and 14 years past, or 13.5 years past that postpartum window, and it still affects me. And so hopefully you can see, this, your own story and what we're talking about here and why it's so important that you get supported. So where does the issue think that's kind of where I'd like to start thinking about, like, why does this happen? Why is this important? Where does the issue start? I don't even know how to dive into this conversation. Actually, I'm going to let you guys guide me. Where do we start with this? How do we unpack it?
Yeah, that's a great question, Jordan. And there's so much there, Laura. And I really had a hard time even figuring out what we wanted to include in this conversation because it's such a big one. And it's interesting because we talk about that like postpartum piece, but we actually see that most of the mood disorders postpartum actually start to show up in pregnancy. And we don't really talk about that very often. There still is like this big stigma around talking about depression, especially in pregnancy, when we have this kind of cultural expectation that we have these happy, glowing mothers. And it's hard to bring that up to a care provider sometimes. And the other piece there is that perinatal mental health disorders are so much more common, I think, than people realize. The statistics show that 1 in 5 women are going to suffer with a mood disorder in the perinatal period at least. And these numbers actually went up a lot over the course of the COVID-19 pandemic. We saw 37% for depression in pregnancy and 57% for anxiety. And so it's common. Like this is such a hugely prevalent issue that I really don't think we talk about enough.
Yeah,
Mhm.
I would agree with that, Carly. And I love to ask people what they think the number one complication of pregnancy and postpartum is, whether it's a practitioner or a patient. And commonly they'll say, gestational diabetes or high blood pressure, but it's actually perinatal mood and anxiety disorders. That's the number one complication of pregnancy and postpartum. And we're not talking about it. And it often goes unrecognized because there's lots of changes that happen during this time. So like changes in your sleep or feeling tired, and people may attribute that to normal, quote unquote, normal pregnancy or normal postpartum changes. So it can be hard to discern what's going on for that person. And, a common saying that being a mom is not a diagnosis, and it shouldn't mean that you have to feel irritable or tired or have mood swings for the rest of your life. Because based on Canadian statistics, an average people live 2/3 of their life after giving birth. And if that's what their new normal is, we shouldn't be okay with that.
Yeah, it's interesting. Like I remember like going to some of my first like therapy appointments in my postpartum window and being like, I don't like this being a parent thing. And it was like this shameful whisper that I said right in this appointment. I'm like, can anyone hear us? I don't like being a parent. And I think when I think about people that are trying to get pregnant, there's so much emphasis on getting that positive pregnancy test. And this is so exciting. And especially for our kind of aging maternal population that maybe they're struggling with fertility challenges. And when they finally do get pregnant, there's a big celebration. And that can be quite a value conflict now that you were like, you couldn't wait to get pregnant. And now it's like derailing you and your mood. And even to be able to go to a doctor and say, like, this is not good for me. Actually, I don't like this. There is so much shame in even admitting that you're unhappy or makes you feel like you're ungrateful for what you have or what you're going to have, to even say that I'm depressed.
Absolutely. And it sounds kind of wild to even say that, because when you think about what a vulnerable time pregnancy is and how many hormonal and physiological and emotional changes are happening, like it makes sense that those struggles are going to be there. And the fact that that stigma is still there is such a huge challenge, because when we don't screen routinely in Canada anyways, we're missing all of these people. And we know that people aren't likely to bring it up to their doctors. Statistics show 88% of women who have depression in pregnancy don't get treatment. And that's a huge problem because, as you said, it lasts, and it can last a lifetime, and it can show up again and again and again. And we're just missing this entire population, which is so sad. And to see people struggle for so long without care is such a huge problem.
Mm-hmm.
So let's talk about like the risk factors in screening here. Like, and you kind of casually mentioned it there, Carly. So I want to spend some time there. Like, what is our current screening guideline, and why is that missing so many people?
Yeah. So we have decided that we aren't screening in Canada currently. And so we just had an update from the Canadian Task Force of Preventative Medicine that updated the 2013 guidelines to say that this is very conditional and it's based on very weak evidence, but we aren't going to routinely screen people. Part of the challenge here is that we don't have a lot of great studies on this. And so we're kind of cherry picking the research a little bit here. The other piece is that we have identified that we don't have the resources to treat people if we catch too many people by routine screening. And so this is a difficult conversation, because by not catching so many people, we're also missing the people that do really need that treatment. And so we have a conditional mention that if we see risk factors, we should be screening people, or we should at least be having a conversation. And many other countries do. The US does, Australia does, Europe does, but Canada at this point in time, we are not routinely screening. And so this is where we end up missing a lot of people, unfortunately.
Mm-hmm. And part of that, like, task force recommendation, they also pooled patients and they said, okay, what's your thought? What's your experience around being asked about your mental health? And their feedback was that they were actually concerned that they might not recognize their own symptoms. And I see that common. People may be able to look back and say, yeah, actually, I struggled in my postpartum, but I wasn't able to recognize that. Or if they did, they might not actually take the initiative to talk to their doctor because of the shame or fear or guilt that they feel around having those feelings. But they did feel strongly about having this discussion about their mental health. They felt that it was important. They just didn't know how to navigate that themselves. So it's really important that we are still having this conversation, even though it's a really tough one to have.
So I find screening evidence and whatnot so interesting. So just for a listener, for a screening program to be effective, and screening means we check everybody, right? So you're probably aware of, or you've participated in a screening program at some point in your life, right? People think of mammograms, people think of bone mineral density or looking for colon cancer. Those are effective screening programs. The PAP testing, that's a screening program. It's where we give it to everybody. And generally the benefits outweigh the risks of us not doing it. And so we just put everyone through a process to try and find disease. Now, in order for a screening program to be effective, we have to find people at a critical window where we can do something about it, right? So if the screening test, doesn't find things at a time that we can make change, well, that's not that helpful, right? Because what are we going to do if it's not a good time for us to treat patients? Or maybe it finds people too late. Like that's not a good screening program either. But what you're saying is that the reason that we don't screen for mental health in women in Canada is not because we couldn't treat them. It's that we don't have the resources to treat them.
Yes. And so it's interesting because when we look at that research too, Jordan, we actually see that if we implement screening, people improve even if we don't actually treat. And so the screening alone potentially has benefit, even if we don't treat. Like having that conversation with a healthcare provider is actually helpful in reducing symptoms of mood disorders. And yet we still haven't implemented it at this point. And so it's interesting when you look at that side as well.
Like, aren't all countries reading the same research? I mean, I know the answer to this question, but like if there are other countries that are doing this differently than Canada.
Yes, absolutely. And even in America, though, they do have we recommend that we screen everyone. And they do have a little clause, though, that if you don't have the resources or the referral network to send someone to, that you actually maybe shouldn't screen that patient. So they do have that little clause as well. But they also have structured it differently in that they even have pediatricians should be screening moms at their well child checks, because we know that they may not make the time to make an appointment for themselves. So if we can piggyback on a moment where they're actually bringing their child in to see someone, and we can take that opportunity to ask them about their mental health, that we actually may be able to catch people at those windows of time, whether it's at their 1 month checkup or their 2 month checkup, that we may see benefit from.
Okay. I don't even know where to go from here. It's not very often that I'm just flat out speechless about a topic, but this one I feel like is so emotional because it's literally we're well, we couldn't do anything for you anyways, so we're not even going to ask. And the gaslighting that creates for the woman, right? If nobody asks, does the woman know that it's not her fault, or that she's not crazy, or that it's not normal, or that it's not her fault? I'm going to say it again, that she could just power through it, and that she'll just get over it, and that she just is doing something wrong. How are we not teaching women that this isn't their fault if we don't actually screen them?
Yeah, absolutely. And I think that when we look at some of the risk factors and how many have been identified in the research, there's a huge number of risk factors that come into play. And ultimately, we should be looking at every person that walks in the door who is in that perinatal period and assessing. One of the hugest risk factors that we can see coming a mile away is if there has been already this history of personal depression or anxiety. And unfortunately, one of the common things that happens in this patient population is that people stop their medication when they're pregnant because they're worried that there is going to be harm towards the baby. And this is so problematic because what we'll see is that the chance of relapse is so high. And this is how many people are on a medication for mood? A lot, right? A lot of people suffer from depression, anxiety prior to pregnancy. And we should be really, really watching these people and making sure we're having these conversations about safe continuation of medication, that there are options to stay on medication or go on a new medication, and being able to have that conversation with a healthcare provider is so important, especially early on. Like if we can do that pre-conception, amazing. If we can do it early pregnancy, really, really important as well.
And there's lots of risk factors that we can see. We almost can see this coming as well, right? So if they had an unexpected pregnancy, if they had a cesarean section, if they had gestational diabetes, these all increase their risk of developing postpartum depression, even if they struggled with PMS, right? So they're very sensitive to their fluctuation in hormones. There's a huge fluctuation in hormones that happens during this postpartum period. And we know that may make you more at risk of developing postpartum depression. Another one that's really important, and I think you've talked about iron before on this podcast, but having anemia during pregnancy or having anemia postpartum. And that's something common that young women will struggle with their iron even before they get pregnant. And that's a risk factor for depression as well.
And so what's the fallout? Like I've read, a smattering of studies on what the fallout of postpartum depression is. And it's interesting because it actually extends well beyond that one person, right? Like if we think from like a community level and from a public health level, by not treating or not screening and treating these people, like the fallout is big, right? Like I've even come across studies looking at the impact of maternal mental health on the well-being of their family and the diet of their family and their kids, engagement in schools and all the things that then become like it ends up being this like intergenerational challenge, because if the parent has struggled and is unscreened and unsupported, that impacts like multiple generations of people actually. But what in your experience and through the work that you're doing, like what's the fallout if we don't do this better?
Yeah, Jordan, you brought up a lot of great points there. And so we absolutely do see that not only is the mother affected, but all of her relationships are affected. And so we do see that it can be really hard to bond with an infant or a child when you are struggling with supporting your own mood and your own needs. It's hard to sustain a relationship with a partner. It's hard to care for your family. You mentioned nutrition. We also see this with other aspects of care, like teeth brushing, for example. We see that mothers that struggle with postpartum mood disorders brush their children's teeth less frequently. And that really does go into the lifetime of the child. We do see that if mothers are not supported through the perinatal period, that their children's mental health can be affected all the way into adulthood. And as you mentioned, that intergenerational mental health piece just keeps going unless we intervene and we care for these people.
And even the mindset of the mother as well. So it's like our actions speak louder than our words. So we show them that they maybe don't matter. We don't give them as many appointments. We gave them like 14 prenatal visits when they were pregnant. We give their child multiple well child checks, and we have this one measly postpartum visit for the mom. And even predominantly as a culture, we ask how the baby's doing, how the baby's sleeping, how the baby's eating. And no one asked the mom if she had breakfast that day or if she slept the previous night, or maybe if she says she's tired, we laugh it off and we say, oh, it's because you're a mom, or welcome to motherhood. It's like this badge of honor that we have to wear of feeling tired and unwell for the rest of our lives, and which is really doing a disservice to everyone, just like you both said.
Yeah. And when you see that reflected back to you or mirrored back to you in your medical care, I think that's where I'm having the biggest challenge, right? Like we can do different in medicine than what culture is doing, right? Like we can take a stand against the overworked, underpaid, busy mom, syndrome. We can medicine has this opportunity to take a stand against culture when it's not serving, right? Like we have that opportunity. But when you're seeing it in your Instagram feed, and then it's reflected back to you where in a place where you're looking for support and you look up to the person who isn't like is supporting you or supposed to be supporting you, there is a system-wide issue that prevents you from being acknowledged or even being able to access care. What's getting mirrored back to you is that this is up to you, right? Or this is your fault, or that we're not here for you, or that you don't matter. And that, I think, is what I have the biggest issue with, right? It's like, we can see myths and crap get perpetuated in, we'll just pick on the online space for a minute, but in medicine, right? Like we're supposed to be doing it properly. We're supposed to be taking a stand for the person in front of us, without all of that background noise. But it actually is in alignment with all of that background noise when they get no appointments. My patients have to beg to get their iron tested postpartum or pay out of pocket for it. And the reason we're not doing it is because we have nowhere to put you if we flag you. Like, what the fuck? Right?
100%.
So what do we do here? And I want to be careful about this part of the conversation. So for the listener, we're going to give you some suggestions and some ideas on how you can make this different, but that doesn't mean that it's your fault. And that doesn't mean that you are the only one that should be responsible for this. We just want you to have an idea of how to support yourself, but hear us loud and clear that you should have been supported before this moment. You should have been offered support by someone you trust on your healthcare team. By us being like, let's empower these women so that they can take care of themselves. Like, you shouldn't have to, right? You guys are nodding feverishly. This is where video would be very valuable. We are all nodding in unison, but I want to be careful about that, because sometimes we have, like, when we have these conversations, we're like, and you can go to the doctor and ask to get your iron tested. Like, the reason we're having to say this is because we have absolutely 100% failed you up until this moment. It's not because you weren't empowered enough at your doctor's appointment.
Yeah, absolutely, Jordan. And Laura and I had a discussion about this before chatting today as well, because there definitely are pieces that come up, but they're often supportive and not necessarily a complete solution. Like, this is a really huge, complex issue. And there's so much going on in this time period in a woman's body that is totally beyond our control. And so I think that's a really good point to bring up, that it's never your fault, right? Like, it's never your fault. And really, as healthcare providers, we are the ones that know this piece. And we do see in the research that by providing education even around this topic and talking about what the signs and symptoms are, what normal looks like, what the actual symptoms of depression and anxiety look like in the perinatal period, and what to watch out for and what to share with your support team to watch out for. These things alone are really helpful. And so one of the key elements for prevention and support, I think, is really that patient education piece and having some of these conversations and just bringing that to the table so that we can have a discussion without the stigma, without the guilt, without the shame, and just talk, right? Just have that conversation. And we do see that if we provide education around some lifestyle interventions, such as sleep and physical activity and nutrition with a patient, but also with the patient's partner in particular, that this has a protective effect on perinatal mood disorders. And I think that's a really important piece, because we're not doing it. Like, who's having those conversations, right? I mean, we are in our offices, but I think that this is really a missing piece to healthcare in this time period.
I would totally mimic that, like social support and having a team on your side. and creating that in advance. So usually I will sit with people in their third trimester and think about these things. They're not thinking about them. It's not on their radar. They're like, okay, I just need to get to the birth part first, and then we'll talk about the after part. But if we can put it on people's radar so they can start to create this team around them and some strategies in advance, it can help if they have someone, whether it's their partner or their friend or a grandparent, that's also helping them to look out for their mood. So putting someone in charge of like, here's what those flags may be. Let's monitor those over time. So you have someone who's on your team for that. Even just thinking about what's going to happen in those like 4 weeks, 4 months postpartum. What does that look like in terms of who's helping? Even just having and setting aside some time for themselves. And I know that sounds really like everybody knows that you need to have some time for yourselves, and it's not super groundbreaking, but they did a study where they explored the relationship between the prevalence of depressive symptoms at 6 months postpartum and the frequency of which they had time for themselves. And they noted that there was this dose response relationship. So the highest prevalence of depressive symptoms were found in women who never had time for themselves. And there was a lower prevalence in people who had time for themselves once or week or more. And so we can know that in our heads, but the hardest part is like, how do we figure out how to do that? And then how do we actually do it? Because it's easy to say like, oh, tomorrow, or I don't want to ask someone to come over, or I can do this all myself. I know that was a common one for me, and it becomes harder the more kids that you add into the picture. And so even if someone took one of the kids, I would still take care of the other one. So still making time for yourself, because that can basically become non-existent if we're not aware of that piece, and knowing that ahead of time so that you can find your partner, the grandparent, the doula, a nanny, a friend, whoever that may be willing to come over and give you that little relief from the responsibilities, because basically every moment of your day, you're responsible for someone else.
I know when I think back to my like that postpartum experience for me, I think that, you know, even my ability to interpret help that was being offered was a bit cloudy, right? And even, you know, so if I was like, okay, I got to go to work and I'll be home at 4, right? If the person who was taking care of my kid was like, what time are you going to be home? And then I'd be like, oh, I can try for 3:30. And then there'd be the pumping and crying while I was driving. And I'm like, but maybe, you know, 13 years later, I can look back and say, maybe actually they were just asking what time I was going to be home and not implying that I needed to be home faster. Right. But I couldn't see it through the depression at that time that, you know, if I asked for a glass of water and, you know, my partner looked at me the wrong way, right, I would be like, you know what, I'll just get it myself. And I couldn't accept the help, or I couldn't accept it like in spite of people's facial expressions or tone, and they were having a hard time too. But what that meant is I actually took less help, because I would just internalize that they weren't actually willing to help me. Because, you know, I probably had a level of depression over the way I was even looking at those interactions, rather than having someone else be like, go have a freaking shower, Jordan. Like all I said was give me a minute, right? Like I needed someone to be able to like more pragmatically look at my mood than for me to be the sole one responsible for finding and accepting the help, because I just actually wasn't in a position to do it for myself then.
Yeah. And they even show people who are struggling with postpartum depression perceive their support to be lower than people who don't have postpartum depression. So it may not be that they don't have the same amount, they just perceive it as differently, and that's not their fault.
That's so fascinating.
I think that also speaks to that piece on educating the support team as well, right? And having those conversations with partners and letting them in on some of the signs and symptoms, because they're not always really obvious, right? And so sometimes when you just see that irritability or even that like rage piece that can come up with postpartum, that partners sometimes just feel like that's on them, and they don't necessarily see that that is part of the depression picture, and it can be really hard to offer support sometimes if you're not seeing that side or understanding that that is coming from that mental health piece. And so again, like making sure everybody is on the same page and knowing what to watch for, knowing how to support, knowing where to offer support. And so some of the things that we see preventative wise are prioritizing sleep for mom and prioritizing things like movement, like just getting outside and going for a walk and incorporating these pieces. And so for partners and other support members on the team, knowing that we need to prioritize these things for the mother, we can offer that support in a way that really is helpful as well.
Mm-hmm. Like you don't get help so that you can go grocery shopping.
Exactly.
Yes.
And we do hear that conversation in that culture online a little bit, right? Where it's like, oh, I had a vacation from my kids and I went grocery shopping. Or,
Yeah.
right, I finally got some time to myself. And so I'm going to, I don't know what, wrap Christmas presents. I don't know, right? Like, but it's like, instead of the thing being like, I'm going to go for a walk around the block without my phone, it's I'm going to do something else to support. It's like the carrying around those like micro responsibilities of being a parent, even into those self-care moments.
Yeah, absolutely. Or go to work or do the laundry or do whatever the thing is that needs to be done, rather than just saying, you know what, like this can be put on hold right now. And that is probably a better use of time for my mental health right now.
Mm-hmm. And sometimes we need someone to mother the mother because they actually can't see that themselves, or sometimes they can't do it themselves because they're flooded with all of these emotions or guilt from leaving. And we need someone to say, just, I need you to leave and I need you to do that walk. And I've got it. I've got everything else. You don't need to worry about it. Right. In an ideal situation, we need to like give that overwhelming amount of support to that person.
It's funny, like early in my practice, I kind of resented working in this space a little bit, right? And probably because I was like in it with them. So maybe I wasn't actually in a position to be able to look at it as pragmatically. But I remember saying to a colleague once, like, I honestly feel like if these women had a grandmother that was more involved or something, that they actually wouldn't need me at all. And I didn't like that I had gone to school for 1.5 billion years to mother someone, right? Like I resented that a little bit. And now, not that I'm that much older at this point, but I actually feel a lot of gratitude for being that person for them, because they don't get it anywhere else. They're not getting it in their conventional medical appointments. They're not getting it from their family dynamic and relationships, because that's not being as supportive as they need to be. I actually want to be the grandma, right? Like I want to be that person that's going to mother those women during that time, to help them be able to take care of themselves. You're absolutely right, Laura. Like that's what they need to be mothered.
And we do see that in other cultures. So it's interesting looking at postpartum in other cultures because they do it differently. And sometimes like the aunts and the moms and the grandmas, and they all come over and they do the cooking and they take care of everyone, where like even during the pandemic, it was like, well, don't see anyone or else, right? Don't have anyone who's not part of your house come into your house. So we kind of lost that piece, and everyone feels like they have to do it all on their own. And that's their responsibility, when we're actually doing people this service by making them do it all themselves.
So where do we go from here? Like, I think we've got probably two audiences of people listening. We've got people right in the throes of it. And then we also have women that are a bit past the acute stage and maybe are living now with some kind of embedded consequences of their maternal mental health challenges. Like, where do we go from here? How can women get help, look for help, get supported, and even get supported when they're well past that postpartum period?
Yeah. And I think it's never too late, right, Jordan? Like, I think you touch on a nice topic there with your own experience and how that kind of showed up later on for you as well. And Laura, as you mentioned, like sometimes we don't recognize it until many years later, and we start to see it show up as continuous struggles with mental health. And so it's never too late to address the issue there. And so reaching out to a healthcare provider is always a great place to start, whether that's your MD, whether that's your ND. In our community, we have a really wonderful team of psychotherapists that work specifically with mothers. And so that's part of my referral network. And we're always making sure that it's a conversation that we have in the perinatal period, but also later on too, that we're connecting women with some of these supports so that they know where to go, who's there to help them, and having those specific referrals, I think, are so helpful so that they don't have to figure it out on their own.
My goal is to
can't
help
do it
you
yourself.
feel more
Like when
confident
you're in the
about your
middle of
health.
it, it's hard to even get through the
Please
day.
remember that what we
It's
talked
much
about today in
harder
the
to have to
podcast
try
does not
and navigate
constitute
the
medical
internet
advice,
and try and figure out
nor
what
was a
your next
doctor-patient
steps are.
relationship
And
formed.
so you really want to find
If you have
that
questions
trusted
about your
healthcare
healthcare or
provider
about how
that
today's
is going to be
topic
able to
pertains
guide
to
you on
you,
that process.
please take it up with your family doctor, your specialist,
and
or someone on
remind
your
you
health
that
team.
you matter, and whatever your experience is or what you're still may be experiencing, whether that's mood or even disruptions with sleep. I'll have people 5, 10, 15, or 20 years later, and I'll say like, when was your last good night's sleep? And they'll be like, oh, before I had kids, right? And even though that was such a long time ago, that's still so prevalent for them, that their health does matter. And that I call it people kind of resurfacing and coming back to finding who they are, finally focusing on themselves, maybe even doing some lab work. Like it could have been years, and same thing. I'll ask people like, when was the last time you had your iron done? And they'll be like, well, I think they checked it when I was pregnant. And again, that could have been 15 or 20 years ago. So even just like doing the baseline lab work and just starting the conversation literally is a great first step.
Yeah, I love that. And I love when people will say, oh yeah, I haven't had lab work done since I was pregnant and I was anemic in pregnancy. And I'm like, oh, okay. So we just have not bothered to follow up on that for the last 10 years. Great.
Yes, absolutely.
So common.
So we've highlighted some major things here. And usually I don't poke holes in conventional care. I mean, we often we're doing the best we can with what we have, but this is one area where we just have 100% dropped the ball. I can't even say it in a different way. I can't even make a good excuse for why we haven't put the resources and infrastructure towards supporting maternal mental health when we look at the negative outcomes of that. And so, I want you to know as a listener that whatever your postpartum experience has been, that it wasn't your fault that you weren't caught. We didn't ask you, right? That was not your responsibility to tell someone. It was our responsibility to ask, and we didn't. And I want you to know that there are people and practitioners out there that are doing it differently. And that's maybe where you get to have a say in how your healthcare goes, is that you choose someone who's choosing you, right? Rather than what we currently have in place. And if you're listening as an older woman or older person and reflecting back on your experience, I want you to know that your, continued mental health challenges that you've had since pregnancy are also not your fault. And we also didn't ask you. But we definitely highlighted some things to watch out for and some risk factors, some blood work that you can have done that do give that puts numbers to how you're feeling a little bit. But also some framework as far as how to think about that postpartum health experience, whether you're currently pregnant, right? And we want you to be having those conversations now, like Laura said, even though that this is maybe not the first thing that comes to your mind. And we want you to know that there are people out there that can support you, right? And that care to support you. I would love to kind of hear from both of you, what your sort of final message is for our audience. What do you want to them to take away from this conversation today?
Yeah, I think I really want people to be aware of just how prevalent mental health concerns are around the perinatal period. I think that we really underestimate how common they are. And this really just promotes the stigma that is there. And I also think that it's really important for people to really appreciate that we aren't screening. And so these things are really under recognized and under assessed and under treated. And if you are struggling with mood, that unfortunately, it may be something that really has to be a conversation that comes to light with either your family or your trusted people that are around you, or a trusted healthcare provider, because they may not be asking you. And if we can have these conversations and start to bring more of this discussion to the table across the board and get this information out there, we're going to be able to support this population better and take away any of that guilt or that shame that really doesn't need to be there.
And I think maybe, can I say it for the 10th time? Like, it's not your fault and that you're not a bad mom if you're struggling with your mood. And you're not alone. There's lots of other people that are feeling the same way as you, even if they're not saying it, even if their social media accounts don't show it. That's really hard, right? To see all of the, really happy baby pictures, maybe, or even pictures of older kids and say, oh, wow, that like mom looks like they have it all together. They probably don't. Like, no one really has it all together, and we all have our things that we're struggling with. So just start the conversation and get someone on your support team who can help you.
Amazing. Thank you both for being here today. And I'm really grateful that we're running this event for healthcare providers to get better equipped to be able to screen their patients. If this is not something that public health has decided is important, we have decided that it is important. And we're going to offer that free training for people that work with women in pregnancy or in the perinatal postpartum period, or if you work with women in general. I think it's a really valuable learning opportunity to understand the complexity of hormones and mood. And pregnancy is like these fireworks between mental health, vulnerability, social support, lack of sleep, and then hormones, which really wires and sets women up for potentially a lifetime of change to their mood and mental health. And we have this like unique opportunity to be able to screen. Interestingly, just by asking you questions, screening helps, but also support. But we can't support if we don't ask. And I think that's really the crux of the conversation today, is that we need to be asking you how you are in order for us to support you. And that's where it starts. So thank you so much, both of you, for being here and for the work that you do. I'm so proud of both of you. You have such major contributions coming to our profession over the next year to support people in this window of life. And so thank you so much for being here today.
Thank you for having us, Jordan. This is really valuable information to get out there, and we're happy to share.
Thanks so much, Jordan.